Thank you.
Dylan?
Hi, my name is Dylan Morey. I want to thank everyone in the committee for taking the time today to hear my perspective. So essentially, as my mom has alluded to, I've been struggling with mental health issues for a long time, since I was 13 years old. Around this time, I developed very severe OCD and anxiety, both of which were very debilitating and really affected the quality of my life. And from the moment I was diagnosed at a young age, I really immersed myself in treatment, very desperate to improve. I've worked with numerous therapists, tried more than 15 different psychiatric medications, and been in and out of partial hospitalization programs with minimal improvement. And all this stress contributed to me developing depression, which had become severe and treatment resistant by the time I arrived in college. And as a result, I had to drop out. I stumbled upon ketamine treatment, and it was very life-changing for me at the time. After only 2 treatment sessions, I experienced an almost complete remission of my depression, OCD, and anxiety that endured for a significant amount of time. And at that time, I finally felt like myself, like an enormous weight had been lifted from my shoulders. But I also felt, a sense of grief after all these years that I'd spent trialing a litany of different traditional treatments that, while they do help a lot of people, they unfortunately weren't effective for me, and almost a decade of my life had passed by. Unfortunately, due to the high cost of the ketamine treatment, I was unable to continue with the infusions when some of my symptoms began flaring back up, which brings me to psychedelics, such as psilocybin. Like ketamine, they also have the potential to change the lives of many people in my situation who have tried these traditional options to no avail while their quality of life declines. I know many people, many friends personally, have been dealing with the mental health system in and out of hospitals for years with no improvement. They've gone through dozens of psychiatric drugs, the majority of which have more side effects than the ones observed in psychedelics. Many of them, such as SSRIs and benzodiazepines, have a black box warning from the FDA due to, I'm sorry, I'm just nervous, but due to increased suicide risk. These drugs are taken chronically every day, SSRIs at least, and withdrawal symptoms are difficult, for many patients as they switch from one drug to the next, which is difficult if the drugs are ineffective. Compare that to psychedelics, which are only taken a few times or even once rather than every single day. If you suddenly stop taking these psychiatric medications, as experienced, the effects can range from unpleasant to dangerous, and they only work as long as you keep taking them. That's not a cure, although I will say that they're helpful. Some people need different options when they're struggling. Psychedelics are non-addictive and don't carry a dependency risk. And I had more to say, I guess, about a lot of the risks that were brought up about psychedelics. All of those risks are present in psychiatric drugs, and in a lot of cases, they're more likely.
So Dylan, that's all written down. Would you send it to us?
Yes, I
We would really appreciate it.
Yeah, I'm sorry.
No, you don't need
kinda
to
made me,
apologize,
silly
just
through
that
the
we are on. And just to share something with you, I had a son who was seriously mentally ill, and I understand and appreciate the difficulty and the trauma of the type of medication that is used to treat serious mental illness. It's a real struggle, and I understand that. But thank you for your testimony, and please send that to us. We'll be happy to read it.
Definitely.
Okay?
Thank you.
Thank you for your
for
time.
coming.